So Inicet May exam just happened on 7th of May, and you must be scrolling for the recall questions. Here's my take for the Inicet May 23 Pediatrics recall. So the first question we are going to discuss is an image based question. They gave an image of a child with a constellation of symptoms. You can see beefy red tongue, strawberry tongue. You can see the neck lymph node, enlarged lymph node. You can see the desquamation of the hands. You can see conjunctivitis. You can see an irritable child and extremities that are red, erythematous, edematous, and there is periungual desquamation of the skin, and also some one other feature, that is the blue lines in the nails are seen. They gave this image and constellation of symptoms, and they asked about the management, and the options were IVIG, aspirin, steroid, and some other option. So first of all, this classical constellation of symptoms is nothing but Kawasaki disease. If I have to define Kawasaki disease in one term, that would be acute febrile mucocutaneous lymph node syndrome. It is a medium vessel vasculitis that is seen in mostly less than 5 years of age children, and the pathology is necrotizing vasculitis of the medium-sized vessels, especially the coronary arteries, right? So coming on to the diagnostic criteria of Kawasaki disease. So Kawasaki disease is essentially a diagnosis of exclusion, and there is no lab parameter that can actually diagnose it. It is a clinical diagnosis. The clinical diagnosis is made by there should be fever for at least 5 days. It is sometimes said that a child with fever, with unknown focus, who is very irritable, you should have Kawasaki disease in your mind. So the clinical diagnosis, fever at least 5 days. Any 4 of the 5, that is lymphadenopathy, unilateral enlarged cervical lymph nodes, and at least one of those lymph nodes should be more than 1.5 centimeter. There should be conjunctivitis, bilateral non-purulent conjunctivitis. It is important to note here that there will be non-purulent conjunctivitis. That means there will be no discharge from the eye per se. Mucosal changes in the form of injected pharynx, lips, and that beefy red tongue, strawberry tongue. Extremity changes in the acute phase, there will be erythema and edema, and in the convalescent phase, you will see desquamation. Polymorphous rash, that is mostly macular rash, never vesicular rash over the body. And lastly, this illness should not be explained by any other disease process. That is, Kawasaki disease is essentially a diagnosis of exclusion. The management of Kawasaki disease is IVIG. You give single dose 2 gram per kg of IVIG along with aspirin and anti-inflammatory doses, that is 30 to 50 mg per kg till the child is afebrile, followed by aspirin in antiplatelet doses, that is 3 to 5 mg per kg for 4 to 6 weeks. Why this management is very important? Because a very dreaded complication, that is coronary artery aneurysm, has a very poor prognosis. It is one of the causes of MI in children along with Al Kappa. So when we treat these Kawasaki disease children, only 3% develop aneurysm, but untreated develop around 15 to 20% aneurysm, and they have a very poor prognosis. So that's why treatment is really important, and the possible reason why they keep on asking the management and pointers related to Kawasaki disease. Next question was about DPT vaccine. So they gave a scenario in which a 6-year-old child came in the immunization clinic, received a DPT vaccine, and he inconsolably cried. Now the child is 10 weeks and he came to the clinic, and the parents said that last time when DPT vaccine was given, the child cried inconsolably for more than 3 hours. So should we give the DPT vaccine now or not? And the options were like that. Don't give the DPT vaccine. Option B was give the vaccine. Option C was give only DT. That is, don't give the pertussis, which is notorious for these side effects. And the last was give only TT. So let's discuss something about this vaccine. So DPT vaccine has 3 components, right? There is diphtheria toxin, D for diphtheria toxin. It is actually neutralized by formalin and then absorbed on the adjuvant aluminium hydroxide. P stands for the pertussis. It is the whole cell killed vaccine. And T for tetanus toxoid. These toxins, they are expressed in the form of limit of flocculation, LF. We write LF. So the amount of diphtheria toxin in the vaccine is 20 to 30 LF. Tetanus toxoid is 5 to 25 LF, and pertussis whole cell kill vaccine is more than 4 international units. So we give this DPT vaccine at the anterolateral mid-thigh intramuscularly 0.5 ml, right? And the primary schedule is 6, 10 and 14 weeks, and boosters are given at 15 to 18 months and 5 years of the age, and this vaccine is stored in the refrigerator at 2 to 8 degrees Celsius, and it is a light sensitive vaccine. The important side effects are local and systemic side effects. Local would be, there would be redness and pain at the site of injection. The systemic side effects are hyperpyrexia, that is fever more than 40.5 degrees centigrade, inconsolable cry. There can be HHE, that is hypotonic hyperresponsive episodes. Neurological side effects can also be seen like seizures or encephalopathy. And it is important to note here that these neurological side effects are mostly with the whole cell pertussis component, right? They're more with the pertussis vaccine rather than the acellular pertussis vaccine. Now the question was basically about knowing that when not to give DPT and when to give. So you need to understand, in case of DPT, there is something known as contraindication and something that is known as precaution. So what do you mean by contraindication? Contraindication means you don't give DPT then. If such of these conditions happen, you don't give DPT, you give DT. But what do you mean by precaution? So precaution means if any of these adverse effects at subsequent doses happens, then further contraindication is there. So the contraindications are if there is any progressive neurological disease. Remember that all those with non-progressive neurological diseases like children with CP, they are not included in this. Progressive neurological diseases are only contraindicated. Children with CP, they can receive the DPT vaccine. Anaphylaxis after the first dose is also a contraindication, and encephalopathy in the 7 days of the previous dose is also a contraindication. So the absolute contraindication are only 3. Progressive neurological disease, then you give DT, don't give DPT, anaphylaxis and encephalopathy in the previous 7 days, right? Now what coming on to the precaution, that means if some of these adverse effect happened at the subsequent dose, then you further contraindicate, right? In this, there is fever that is more than 40.5 degrees Celsius within the 48 hours, and hypotonic hyperresponsive episode in less than 48 hours, persistent inconsolable cry for more than 3 hours within the 48 hours, and seizures within the 72 hours. So these are the 4 precautions. That means if any of these complaints are present, then you give away that dose, and if it repeats, then there is contraindication. Now coming on to the next question, they gave an image based question in which a child with rosy pink cheeks, slapped cheek appearance is seen, and they asked about the complication that is associated with this virus. So one of those options were pure red cell aplasia, other was Kaposi sarcoma. So we all know that this slapped cheeked appearance is caused by a DNA virus, parvovirus B19, and this disease is 5th disease or erythema infectiosum, and it is a very common exanthematous illness of childhood. The peak age of this disease is 5 to 15 years, and the incubation period is 4 to 28 days. The spread is through respiratory route. In this, you'll initially see a prodrome followed by a macular red rash on cheeks that spreads down to the trunk and the proximal extremities. The complications that are seen with this virus is arthropathy, idiopathic thrombocytopenic purpura, transient meningitis, transient aplastic crisis in patients with chronic hemolytic anemias. In immunocompromised patients, and hemophagocytic syndromes can be seen, and in pregnant women, eye drops can develop. The important point here is that parvovirus B19 has a tropism for cells of the erythroid lineage at the pronormoblast stage, hence the pure red cell aplasia. So one of the complications is pure red cell aplasia. Now coming on to the next question. The next question was related to the NADA's criteria, that is the criteria for diagnosing the congenital heart disease. They asked about the minor criteria, and the options are somewhat like this: systolic murmur grade 1, diastolic murmur, CHF, cyanosis, pansystolic murmur grade 1. So coming on to the NADA's criteria, the NADA's criteria has major criteria and minor criteria, and 1 major or 2 minor indicate the presence of heart disease. Remember, it's or. So you need only 1 major or if none of the major is present, 2 minor will indicate the presence of heart disease. Major are 4, minor are 5. Major criteria are systolic murmur equivalent to grade 3 or more than grade 3, any diastolic murmur, cyanosis and CHF, that is congestive heart failure. Minor criteria are systolic murmur less than grade 3, and abnormal S2, abnormal chest X-ray, abnormal ECG and abnormal BP. The point here to note is that in case of systolic murmur, you say if it is less than grade 3, it's a minor criteria. When it is grade 3 or more, it is a major criteria. But pan-systolic murmur is always abnormal, no matter what the intensity is there, right? So VST, MRT, they all cause pansystolic murmur and they are always abnormal. So if a pansystolic murmur is present, then you don't go on the intensity, whether it is grade 1 or 2, it is abnormal, there is some heart disease, right? Now coming on to the next question. They gave a child with vomiting and diarrhea for the past 3 days, and now the child presents with seizures and altered sensorium. And what is the cause of it? The options were like hypo or hypernatremia, there was hypoglycemia, there was cerebral venous or cerebral your sagittal sinus thrombosis and meningitis. So an important points that are also mentioned in OPGAI, if the seizures are associated with diarrhea, the causes can be either hyponatremia, there can be hypoglycemia, there can be hypokalemia, followed by the bicarb therapy that we give for acidosis and diarrhea patients, encephalitis and meningitis, and cerebral venous or sagittal sinus thrombosis. Next question was match the following question, in which the syndromes were given: Edwards syndrome, trisomy 18, Patau syndrome, trisomy 13, sickle cell anemia, glutamine is replaced by valine, and Huntington disease, which is a trinucleotide repeat disorder. Another match the following question, in which maximum incubation period was asked. SARS virus, chickenpox, hepatitis A and syphilis were given. SARS, the incubation period ranged somewhere from 2 days to 14 days, so maximum is 14 days. For chickenpox, 10 to 21 days is the range, so maximum is 21 days. For hepatitis A virus, 10 to 50 days is the range, and 50 days would be the maximum. And for syphilis, 10 to 90 days, and 90 days would be the maximum incubation period. The next question was for iron deficiency anemia, and they asked about the iron profile for that child. The first option was decreased ferritin, which is true, stores would be less in iron deficiency. Total serum iron less, which is true. Transferrin saturation less, true. TIBC, that is total iron by iron capacity, would be increased because total iron is less. So all these options are correct. The last question was given a MSL baby, so meconium stained liquor is seen and that baby is going to be delivered, and they asked which of the statements is true. So baby is yet to come out and you suction the mouth and nose, which is not done. So this is the wrong statement. The next statement was positive pressure ventilation in a non-vigorous baby is done after the initial steps, which is true. The third was gentle suctioning of the vigorous baby is done, which is true. Gentle suction can be done if required. Last is tracheal suctioning followed by mouth suctioning, which is false. Tracheal suctioning is not done nowadays. So that's it for the recall of pediatric section of Inicet May 2023. I hope your exam went well. It's the time to relax now, because now the next exams are quite far in November. So all the best. Happy studying. Bye bye.